Okay, that's not. Hello everyone. I hope you people can hear me. We'll just begin in another 5 minutes. So I will take the questions in the comment box at the end of session. First, we will begin the session in another 2 to 3 minutes. Hi everyone. So I am Dr. Shubham Viduri from Indira IVF, Thanisandra, Bangalore, and I am glad that you people are joining us today. I hope my voice is clear. Yeah, just a minute. So yes, hi everyone. No, the voice, is it okay? Okay, so hi everyone, this is Dr. Shubham Viduri from Indira IVF, Thanisandra, Bangalore, and I'm glad that you all are joining us today for this session. So whether you're watching it live or you will watch it later on, I hope this session is able to give you some valuable insights which will help you navigate through your IVF journey, and especially for those who are struggling and who have had the previous 1 or 2 failed IVF cycle. So before we begin this session, I just want to say that if you have recently gone through an IVF cycle and आपको positive result नहीं मिला, so I just want to say that as doctors, we truly understand that how emotionally and financially draining it is. And it's just, I want to say that one failed IVF cycle does not mean that all hope is lost. You still can have success in your next cycle. So, and also I want to say that one failed IVF cycle, a lot of people are dealing with this problem. So you are not alone in this. And many people, they go on to have success in their second and third cycles. So without wasting any further time, let's just begin this session. So today I will speak about IVF failure, what are the causes of IVF failure, and how we can plan our next cycle ताकि हमें better results मिले, and what should be the ideal gap between 2 cycles. So let's just begin section wise. So first is understanding the IVF failure. So it is very important that you understand that why the IVF cycle fails, जिसके बहुत सारे reasons हैं, and in most of the cases it is usually a combination of factors. तो ये factors क्या हैं, चलिए इनके ऊपर बात करते हैं. So first of all, the response of your ovaries to the stimulation. So there could be multiple issues. So response of your ovaries to the stimulation. तो कोई भी इशू हो सकता है जिसमें आपकी ovaries are not responding to the injection, the hormone injections which are given to you. Then there could be issues related to your embryo quality. Then after the embryo quality, there could be issues related to your uterus, that is the lining of the uterus. If there is any other associated issues such as fibroid, adenomyosis, endometriosis, then there could also be immunological reasons. And lastly but not least is the male factor, that is issues related to the husband semen parameters. तो चलिए इन सब के बारे में अब डिटेल में बात करते हैं. ओके, सो what is ovarian response, what is ovarian reserve? See, every woman is born with a specific number of eggs, and with each cycle the number of eggs reduces. तो on the day of stimulation आपकी ovaries में कितने eggs हैं, this will predict your results. So it is very very important that the number of eggs in the ovaries, they predict your response to the stimulation cycle. And as we all know, with increasing age the number of eggs decreases. So one is the number of eggs. Second, the quality of the eggs. So apart from number, the quality of the eggs is also very important. Although there is no direct test to check the quality of the eggs, but in conditions like PCOD, endometriosis, the quality of egg might also be a problem. Okay, so with the number, the quality of oocytes is also to be kept in mind when starting a cycle. तो ये एक रीज़न हो सकता है फेलियर का. And with increasing age, not just the number, the quality also decreases. Then after the oocyte comes the embryo quality. अब अगर आपने अच्छी क्वालिटी के एग्स निकाल लिए and on the day of pickup that egg is fertilized with the husband's semen and embryo is formed. अब क्या करते हैं? That embryo is grown in the lab known as the blastocyst culture, and the embryologist will give a grading of the embryo. Okay, so it's given a grading like good, bad, or poor quality embryo. Now you have to understand that this quality is basically given by the embryologist on the basis of morphology of the embryo. मतलब कि वो माइक्रोस्कोप में देखकर बताते हैं कि ये एम्ब्रियो अच्छी क्वालिटी का है, पुअर क्वालिटी का है, एवरेज क्वालिटी का है. But this is not sufficient. Actually, there is another test called as pre-implantation genetic test. So, अगर एम्ब्रियो अच्छी क्वालिटी का है उसके बावजूद भी IVF फेलियर हो सकता है. तो अब इसका क्या तरीका है? So there is a test which is PGTA, pre-implantation genetic test for aneuploidies, which basically detects the chromosomal abnormalities in the embryo, which is again a major cause of miscarriages, abortions, and finally the cycle failure. Then apart from quality genetic testing, now coming to the uterine factors. अब आती है बात यूट्रस की. अगर यूट्रस की लाइनिंग इज नॉट गुड, नाउ व्हाट डू यू मीन बाय गुड? गुड मीन्स द थिकनेस ऑफ द एंडोमेट्रियल लाइनिंग. सो एंडोमेट्रियम लाइनिंग मतलब आपके यूट्रस की अंदर की परत अगर सही हिसाब से मोटी और अच्छी नहीं है तो आप कितनी भी अच्छी क्वालिटी का एम्ब्रियो बना लीजिए, इट विल नॉट गेट इम्प्लांटेड. So the lining of the embryo, the lining of the uterus is equally important, and ideally what we take is 7 to 8 mm is a normal endometrial lining. Then apart from thickness, quality of the endometrial lining, there are other conditions such as fibroid, adenomyosis, endometriosis, जिनकी वजह से यूट्रस की मॉर्फोलॉजी एंड यूट्रस के अंदर का environment can get for the embryo, and even a good quality embryo might not get implanted. Then after these factors, another very important and very less discussed factor is the immunological factor. अब इसके बारे में डिटेल में समझते हैं. Embryo is basically considered as a foreign body by the mother's body. Not in all women. Actually, in some women, embryo is identified as a foreign material. And now what happens is the mother's body, it produces a immunological reaction to trying to expel the embryo out of the body. Now routinely ये टेस्ट हर पेशेंट में नहीं किए जाते हैं. हर IVF साइकिल में routinely these tests are not done. But if you have had 1 or 2 failed IVF cycles, then you should definitely discuss with your doctor. Then they might explain to you the immunological factors, and you can go under various blood tests to check these factors, and then a targeted therapy can be given to you. So immunological factor is a very major reason of IVF failure. Then last but not the least, again the semen factors, the husband semen analysis. So if there are issues related to the morphology, the motility, and the count of sperms, that again might result in a failure of the IVF cycle. But there are ways to tackle those. So there are additional tests apart from husband semen analysis, which are DFI, and then there are various sperm sorting techniques, which basically means to select a best quality and a good quality sperm for an IVF procedure. तो ये तो बात हो गई कि IVF फेलियर के मेन कुछ रीजंस क्या हैं और डिटेल में उनका क्या क्या इम्पैक्ट होता है IVF फेलियर के ऊपर. Now how to tackle this? And what should be your approach in the second cycle? So what I want to tell all of you, that before you think of beginning the next cycle, you should visit your doctor, your fertility specialist, and actually sit with them and speak in detail about your first cycle. So the first and foremost point is to analyze the first cycle. See, now this is very very important. कोई भी सेकेंड साइकिल या थर्ड साइकिल स्टार्ट करने से पहले बहुत ज़रूरी है कि हम ये समझें कि पहली साइकिल में किस पॉइंट पर प्रॉब्लम आई. So yes, you can definitely go to your doctor, and with respect to these points which we just discussed, you can discuss with them, you can question them, and then in collaboration the doctor will form a plan for you. So first is analyze your previous cycle with your doctor with respect to the points we just discussed. Now what will doctor do in the second cycle? आप पूछेंगे ऐसा क्या आप अलग करोगे अब इस साइकिल में. तो सबसे पहली चीज़ आती है स्टिमुलेशन प्रोटोकॉल. सो डॉक्टर माइट चेंज योर स्टिमुलेशन प्रोटोकॉल. अब स्टिमुलेशन प्रोटोकॉल का मतलब है जो भी हार्मोन इंजेक्शन आपको दिया जा रहा है. सो डॉक्टर माइट चेंज द टाइप ऑफ इंजेक्शन, द डोजेस ऑफ इंजेक्शन, किस हिसाब से आपको इंजेक्शन देना है. ऑल दीज फैक्टर्स विल डिसाइड कि हमारे को सेकेंड साइकिल में किस टाइप के रिजल्ट मिलेंगे. सो doctor might change the protocol, and also in addition to the basic hormone injections, अगर response poor आ रहा है या डॉक्टर को लग रहा है कि follicles are not growing, so they might add some additional hormones or additional injections such as growth hormone and other additional additive medicines. ठीक है. So apart from these, the stimulation, when you know okay the protocol has been changed, now the eggs are growing nicely and a good quality egg will be retrieved. Second is you can definitely discuss with your doctor that whether to opt for a genetic test of the embryo or not. If already a good quality embryo was transferred to you in the previous cycle, so in the next cycle you should definitely discuss with your doctor that what are the implications of PGTA test in your case. And this is specifically important for women more than 35 years of age. And this might improve your chances in the second cycle. Now coming to the third factor, which is the uterus. So if your lining was thin in the first cycle या अच्छी क्वालिटी की लाइनिंग नहीं बनी थी, तो इस बार डॉक्टर आपको कुछ एडिशनल प्रोसीजर्स एडवाइस कर सकता है, जैसे कि हिस्टेरोस्कोपी, which is basically looking inside the uterus through a camera and to actually see the endometrial lining. See, normally एक साइकिल में एंडोमेट्रियम को असेस करने का जो कॉमन तरीका है वो अल्ट्रासाउंड है. बट अगर एक साइकिल में हमें सक्सेस नहीं मिला है एंड वी फेल्ट कि ओके एंडोमेट्रियम लाइनिंग कुड बी द प्रॉब्लम, सो द बेटर वे टू असेस द एंडोमेट्रियम इन द सेकेंड साइकिल इज थ्रू हिस्टेरोस्कोपी. एंड इफ देर आर एडिशनल फैक्टर्स जैसे कि फाइब्रॉइड है, एडिनोमाइसिस है, एंडोमेट्रियोसिस है, देन अ लैप्रोस्कोपी में ऑल्सो बी एडवाइज टू यू. सो यू डिस्कस विद योर डॉक्टर कि ये सब चीज़ें आपके केस में रिक्वायर्ड हैं या नहीं है, बिकॉज डेफिनेटली इफ देर आर एडिशनल कंडीशंस अफेक्टिंग योर सिस्टम तो ये दोनों प्रोसीजर्स आपको हेल्प करेंगे. नाउ फाइनली द फोर्थ वन, इम्यूनोलॉजिकल फैक्टर. अगर सारे रीजंस हमने सॉर्ट आउट कर लिए हैं, then the final test we have is the immunological testing. मदर की ब्लड टेस्ट करके हम कुछ इम्यूनोलॉजिकल फैक्टर्स को असेस कर सकते हैं, एंड बेस्ड ऑन दैट वी कैन ऑफर यू थेरेपीज विच इज कॉल्ड एन LIT थेरेपी और अ स्टेरॉइड थेरेपी टू काम डाउन योर इम्यून रिस्पॉन्स, ताकि जब एम्ब्रियो ट्रांसफ़र हो तो आपकी बॉडी एम्ब्रियो को एज अ फॉरेन मटेरियल ना कंसिडर करे. एंड देन अगेन द मेल फैक्टर, इट हैज़ टू बी असेस्ड अगेन. अगर उसमें कोई प्रॉब्लम है देन वी हैव टू अपग्रेड द टाइप ऑफ टेस्ट, and of course the sperm sorting techniques can be used to select the best quality sperm if the male partner is suffering from any of the abnormal semen parameters. अब ये तो बात हो गई कि what all medical considerations will be done by the doctor, कि सेकेंड साइकिल में डॉक्टर क्या क्या चेंजेस कर सकता है ताकि आपको बेस्ट रिजल्ट्स मिले. बट एज अ पेशेंट आप क्या करोगे? This is now equally important and again very ignored topic, which is lifestyle modification. अब हर कोई क्लिनिक में बोल देता है lifestyle modification करिए, but how many of you are actually doing it? Because people fail to understand that lifestyle modification has equal implications as you're changing the stimulation protocol. तो अगर आपका वेट ज़्यादा है और अगर आप हायर BMI कैटेगरी में हो, सो यू हैव टू रिड्यूस योर वेट and come down in the normal BMI range, which is around 18.9 to 18.5 to 24.9. So you have to work on yourself before starting the second cycle. You have to attain a healthy lifestyle by changing your diet. Some form of exercise should be there in your day-to-day activity. You have to learn to manage the stress, quit smoking, reduce alcohol, eat a lot of vitamin C rich food, drink a lot of water, and include some form of yoga, meditation, and physical activity in your lifestyle. See, these are very commonly said topic, but very ignored topic when it actually comes to रियल एप्लीकेशन. तो इन पॉइंट्स को बिल्कुल इग्नोर ना करें. लाइफस्टाइल को सबसे पहले सेट करना है बिफोर गोइंग इनटू द नेक्स्ट IVF साइकिल. एंड देन अगेन फाइनली विच I feel is also very very ignored concept is emotional healing from the trauma of the first cycle. See, IVF itself is it's a roller coaster ride, and especially for the female to go through so many procedures, so many injections, scans, and then finally getting a negative result. So you have to emotionally heal from that past event, and for that, if you need to speak to your therapist, if you need a psychological counseling, or else if you need to speak to your doctor also. So all I want to say is just reach out and speak up, because if you are not emotionally healed, if you are emotionally not healthy, then again that redundant stress will remain in your body, and God knows the second cycle it might get affected by the stress only. So emotional health has to be taken care of. But now coming to the third topic is how much time should you take before starting the second cycle for emotional healing, for physical recovery, or whatever. So actually now speaking about the time between the two cycles, there is no perfect answer for it. It varies from case to case. So you actually have to discuss with your doctor in detail that how much duration will be applicable in your case. See, for physical recovery, they say around 1 to 2 menstrual cycle gap is important, or it's required for your ovaries and your endometrial lining to regenerate. But that is not the case with everyone. Okay, so if your age is on the higher side, your AMH is already low, the number of follicle count is also low, then doctor might suggest to start the cycle immediately. Also, if you have a frozen embryo from the previous cycle, then that much gap is not required. You just need to emotionally heal from that thing, and then probably in a month you can go with the transfer cycle. So actually the duration will be a collective decision between you and your doctor depending upon your case and your fertility parameters. So this is all from my side. I think let's just take few questions from the comments. People have put a lot of comments. So Murlidhar Rawat said, मैम AMH is 1.08, तो IVF में प्रॉब्लम तो नहीं होगी, एज 30. So Murlidhar, actually no, we first have to see the number of follicle count. See, AMH 1.08 is okay, but what is more important is कि आपके follicle count कितना है. The number of follicles in your ovary is actually the real indicator. AMH is also an indicator, but follicles कितने हैं, that is the roadmap for the success of the IVF cycle. So yes, definitely you can have success. You might have problem, but it's not like you will not succeed. Okay, now somebody has asked, Nitesh Rai, explaining the procedure of endometrial scratching. So yes, this is important. So when I was talking about thin endometrial lining, so endometrial scratching is basically an OPD based procedure to deal with an issue of thin endometrium in some cases, not in all cases, you have to understand. So basically with a thin cannula, it's a plastic cannula, it's an OPD based procedure. With that thin cannula, it is put inside the uterus and the endometrium lining is stimulated. वो कैनुला से एंडोमेट्रियम की लाइनिंग को स्टिमुलेट किया जाता है ताकि एंडोमेट्रियम की लाइनिंग का ब्लड फ्लो इंक्रीज हो एंड इट बिकम्स हेल्दी. See, when I was speaking about endometrial lining, I told you the thickness and the quality both are important. So if the doctor decides, the endometrium is not looking thick, is not looking healthy, then she might take a call to do the endo scratching. So it's a simple OPD based procedure in which the cannula is put inside the uterus and it's not like a rough scratching is done, a very gentle scratching is done to increase the blood flow into the endometrium. So I think if you need a separate video on the whole procedure and explaining it with a video, I think we would do that soon. Further questions? So somebody has asked, is progesterone injection will be continued? So it depends on the case to case. In majority of the patients, yes, they are continued. मीना देवी जी, आपने पूछा है कि औरत की नसबंदी के बाद आईवीएफ से बच्चा सक्सेस हो सकता है. तो औरत की नसबंदी मतलब बायलैटरल ट्यूबल लाइगेशन अगर किया है तो बिल्कुल आईवीएफ सक्सेस हो सकता है. डिपेंड करता है कि आपकी ओवरीज में कितने एग्स हैं और आपका एमएच काउंट कितना है. अगर ट्यूब्स बंद हैं, नसबंदी करी हुई है, तो भी आईवीएफ सक्सेस हो सकता है डिपेंडिंग ऑन द नंबर ऑफ एग्स. मतलब कि आपकी ओवरी में कितने एग्स बचे हैं उसके बेसिस पे बिल्कुल आपको सक्सेस मिल सकती है. So I think I'll wait for another 2-3 minutes. If there are any more questions, you can put it in the comment box. I'll try to take those questions. So, okay, so I want to thank you, all of you, for joining this session, and I hope I was able to provide you some valuable insights which will help you in your IVF journey from here on. And I really encourage all of you to visit your fertility doctor and discuss in detail, and I'm sure they will help you. So, IVF is difficult, but with right information, correct guidance, and good support system, you can definitely have success. So, thank you for being here, for being patiently listening, and I wish you all the best for your journey. Thank you so much, everyone. Thank you.